Hello dear learners, welcome back to you and learn English grammar with me. If you want to learn English grammar with the easiest way, subscribe my channel and press bell icon to get my new videos. Dear learners, ভিডিওর থাম্বনেল দেখে অবশ্যই তোমরা বুঝতে পেরেছো আজকের এই ভিডিওতে কি রয়েছে। তারপরে আমি তোমাদেরকে বলতে চাই যে একবিংশ শতাব্দীতে সবচেয়ে বড় চ্যালেঞ্জ হচ্ছে কোভিড-19। এই কোভিড-19 সারা বিশ্বকেই প্রভাবিত করেছে। আর কোভিড-19 পরবর্তী সময়ে তোমাদের যখন শিক্ষা প্রতিষ্ঠান আবার পুনরায় চালু হবে তখন অবশ্যই তোমাদেরকে এই কোভিড-19-এর উপর একটা কম্পোজিশন, একটা প্যারাগ্রাফ, একটা ডায়লগ বা একটা লেটার বা একটা অ্যাপ্লিকেশন এবং একটা রিপোর্ট সম্পর্কে তোমাদেরকে জানতে হবে। তাহলে আজকের এই ভিডিওতে আমি অবশ্যই তোমাদের কাছে একটি কম্পোজিশন তুলে ধরবো। আর এই কম্পোজিশন তুলে ধরার জন্য আমি তোমাদেরকে এখন কম্পিউটার স্ক্রিনে নিয়ে যাব। ওয়েলকাম টু মাই কম্পিউটার স্ক্রিন। কম্পোজিশন COVID-19 coronavirus. Introduction. Currently the entire world is experiencing the desolation and devastating of a deadly virus. The new disease of COVID-19 emerging from the new coronavirus SARS-CoV-2 has spread throughout the world, affecting more than 220 countries and millions of people with discouraging morbidity and mortality figures. Coronavirus. What is coronavirus? Coronaviruses are a large family of viruses which may cause illness in animals or humans. In humans, several coronaviruses are known to cause respiratory infections ranging from the common cold to more severe disease. COVID-19. COVID-19 is the infectious disease caused by the most recently discovered coronavirus. CO stands for corona, VI for virus, 19 the year in which it appeared. The new virus and disease were unknown before the outbreak began in Wuhan, China in 31st December 2019. The current scientific consensus is that the virus is most likely of zoonotic origin from bats or another closely related mammal. Symptoms. The most common symptoms of COVID-19 are fever, tiredness and dry cough. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome and even death. The less common symptoms are ashes and pains, sore throats, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. COVID-19 coronavirus pandemic. Approximately all the countries of the world have been affected by COVID-19. The coronavirus COVID-19 is affecting 222 countries and territories. Worldometer info coronavirus in 12 July 2021. The number of affection is increasing day by day. The overall number of global coronavirus causes has surpassed the 187.9 million mark, while the deaths have increased to over 4 million according to the Worldometer info coronavirus in 12 July 2021. Coronavirus in Bangladesh. The COVID-19 pandemic in Bangladesh is a part of the worldwide pandemic of coronavirus disease 2019 COVID-19 caused by severe acute respiratory syndromes coronavirus 2 SARS-CoV-2. The virus was confirmed to have spread to Bangladesh in March 2020. The first 3 known cases were reported on 8 March 2020 and first confirmed COVID-19 date on 18 March by the country's Epidemiology Institute IEDCR. Since then, the pandemic has spread day by day over the whole nation, and the number of affected people has been increasing. The overall number of Bangladesh coronavirus cases has surpassed the 1.02 million mark, while the deaths have increased over 16,419 according to the Worldometers Info Coronavirus Country Bangladesh in 12 July 2021. Spread of COVID-19. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or breathe. These particles range from larger respiratory droplets to smaller aerosols. Current evidence suggests that the virus is spread mainly between people who are in close contact with each other, typically within 1 meter short range. A person can be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth. The virus can also spread in poorly ventilated and or crowded indoor settings where people tend to spend longer period of time. This is because aerosols remain suspended in the air or travel further than 1 meter long range. Medical treatment. Possible vaccines or some specific drugs treatments are under investigation, but there is no specific antiviral medicine to prevent or treat instantly after affecting COVID-19. However, those affected should receive care to relieve symptoms. People with serious illness should be hospitalized. Most patients recover thanks to supportive care. Scientists around the world are working to find and develop treatments for COVID-19. Optimal supportive care include oxygen for severely ill patients or those who are at risk for severe disease, and more advanced respiratory support such as ventilation for patients who are critically ill. Dexamethasone is a corticosteroid that can help reduce the length of time on a ventilator and save lives of patients with severe and critical illness. Self-care. After exposure to someone who has COVID-19, do the following. First, call your health care provider or COVID-19 hotline to find out where or when to get a test. Cooperate with contact tracing producers to stop the spread of the virus. If testing is not available, stay home and away from others for 14 days. While you are in quarantine, do not go to work, to school, to public places. Ask someone to bring your supplies. Keep at least 1 meter distance from others, even from your family members. Wear a medical mask to protect others, including if when you need to speak medical care. Clean your hand frequently. Stay in a separate room from other family members, and if not possible, wear a medical mask. Keep room well ventilated. If you share room, place bed at least 1 meter apart. Monitor yourself for any symptoms for 14 days. Call your health care provider immediately if you have any of these danger signs. Difficulty breathing, loss of speech of mobility, confusion or chest pain. Stay positive by keeping in touch with loved one by phone or online and by exercising at home. Highly risky people. While we are still learning about how COVID-19 affects people, older persons and persons with pre-existing medical conditions such as high blood pressure, heart disease, lung disease, cancer or diabetes appear to develop serious illness more often than others. protections. We can reduce our chances of being affected or spreading by taking some simple precautions. Regularly and thoroughly clean our hands with alcohol-based hand rub or wash them with soap and water, because this action kills viruses that may be on hands. Keep a safe distance at least 1 meter 3 feet from people. The virus is contaminated in saliva droplets and can be transmitted by breathing at close range, particularly when they cough, sneeze, and or have a fever. Avoiding touching eyes, nose, and mouth, because hands touch many surfaces and can pick up viruses. One contaminated hands can transfer the virus to others' eyes, nose, or mouth. From there, the virus can enter our body and can make us sick. Make sure us and the people around us following good respiratory hygiene. This means covering our mouth and nose with our bent elbow or tissue when we cough or sneeze. Then dispose of used tissue immediately. Droplets spread virus. By following good respiratory hygiene, we protect the people around us from viruses such as cold, flu, and COVID-19. Avoiding shaking hands and hugging for the reasons mentioned above. Stay at home as much as possible, following the rules indicated by the authorities. If we have a fever, cough, or difficulty breathing, seek medical attention and call in advance. This will allow your healthcare provider to quickly direct us to the right health facilities. This will also protect us and help prevent the spread of viruses and other infections. All the measures included in the present leaflet follow what established by the World Health Organization. Conclusion: The virus that causes COVID-19 is mainly transmitted through droplets generated when an affected person coughs, sneezes, or exhales. These droplets are too heavy to hang in the air or quickly fall on floors or surface. We can be infected by breathing in the virus if we are within close proximity of someone who has COVID-19, or by touching a contaminated surface and then our eyes, nose, or mouth. So we should be extremely aware during COVID-19 pandemic in touch of anyone, as man is the only bearer of spreading of COVID-19. Okay, thanks all. Next, I come back again the COVID-19 paragraph. তাহলে আজকের এই ভিডিওতে COVID-19 সম্পর্কে একটা কম্পোজিশন তোমাদের কাছে উপস্থাপন করলাম। আগামী ভিডিওতে একটি প্যারাগ্রাফ তোমাদের কাছে উপস্থাপন করব। ধন্যবাদ সবাইকে।